Listening to KFRU in Columbia Morning. And let's talk about something that I've seen in some articles over the last few days and know that the University of Missouri at MU Healthcare has a researcher and a physician there who has also been looking at the connection between COVID-19 and stroke. Our guest is Dr. Adnan Qureshi, and he joins us right now. Dr. Qureshi, good morning. How are you today, sir?
Good morning. I'm doing very well.
So I want to refer to a couple of headlines that I've seen recently in some of the national publications. One from the New York Times. It had a headline, and this was from a little over a week ago. Coronavirus may pose a new risk to younger patients, strokes. And then another headline, and I think this one was as recently as just today, amid coronavirus shutdown. It was a story about a tennis coach's stroke went undiscovered for days. Fill us in on the work and the connection that you've been doing, and we'll ask you along the way what that means. But what had you seen that led you to look into this?
So I think that, first of all, every respiratory tract infection has always had some increase in the risk of stroke and myocardial infarction or heart attacks. So there's always been a reason to suspect that COVID-19 will also have some effect on stroke because there is an increased tendency of blood to clot in people who have these kind of infections. COVID-19 in particular seems to have a exaggerated risk of increased clotting in the blood. So I think that there was already a suspicion even when COVID-19 first started, and that suspicion was actually confirmed when several reports started coming in that people are actually coming, particularly young individuals, are coming to the hospital and then they actually have a stroke with no other reason to explain the stroke, and then subsequently they're found to have COVID-19 infection.
Yeah, I can see what you're talking about because, in other words, somebody who was younger than what would normally be maybe a stroke victim, comes in with those kind of symptoms. I don't know how quickly someone in an emergency room or diagnosing what the situation was would immediately have thought COVID-19. Is that what you're saying?
Yes, and I think that actually posed a lot of challenge for us because when we are evaluating patients with strokes in our hospitals, now we actually have to consider the possibility that they may actually have COVID-19 infection. And a lot of time, as you know, the stroke is a very time-sensitive disease, so treatment has to be administered as quickly as possible. And then on the other hand, you also have to make sure that you understand whether the patient actually has COVID-19 infection or not.
I can see how that would complicate the matters of trying to treat that individual.
Yes.
You would have a situation where someone would be saying, well, we have a stroke victim, and then added on to that, does that change? I mean, obviously the protection of the caregivers and the hospital staff would have to be very much a concern. But then I'm also wondering, can you treat a stroke victim who doesn't have COVID-19 the same way you would treat a stroke victim who does have COVID-19?
I think that there are certain additional considerations that go into play. I think that if somebody actually has a COVID-19 infection and is actually coming in with a stroke, we immediately start considering that whether other body system may be involved with COVID-19. So unlike a stroke patient who doesn't have COVID-19, where we're just focused on the brain, here we actually have to start worrying about the lungs, the kidneys, the liver, because COVID-19 infection is not something that's just limited to a stroke. It already is most likely going to involve other areas of the body as well. So the picture becomes a more global picture than just a very focal picture, which we usually do or consider when we're treating a stroke.
In your looking at this, how much has this happened? How much is this happening now? I guess I'm asking the frequency of COVID-19 causing strokes to occur in individuals of any age, I suppose.
I think I'm glad you asked that question. So when the international panel that was formed, and our hospital being the lead in that, so people from 18 countries got together to, estimate that what will be the effect of COVID-19 based on the initial evidence we have. And at that point, our concern was that there may be a dramatic increase in the number of stroke patients that we will see at our hospital, because you actually have a new reason in the community to cause strokes. Now, it is interesting that since that panel had convened, and as many had expected, the number of stroke patients will actually go up. Instead, we are actually seeing that it's starting to decrease. So the question becomes is that possibility is, it's because some people are just not coming to the hospital because they're too worried about actually getting COVID-19 infection in the hospital. And that's actually an important issue, because essentially by avoiding coming to the hospital, I think the chance of actually coming to the hospital and acquiring COVID-19 is very limited for a new patient. But actually not coming to the hospital with a stroke or stroke-like symptoms, there may be a considerable price to pay by missing out on the treatments that are available.
I think it's
the second. Go ahead.
Well, I was just going to say what you just said. I wanted to reemphasize that because I think it's important. I understand people saying, well, I don't want to go to the emergency room with COVID-19 fears that I have, but it's hard for me to imagine somebody who is experiencing stroke symptoms not seeking out emergency help.
And the other consideration is that even if people do decide to go to the hospital, they're so reluctant initially, so they actually wait too long to come to the hospital, and then essentially the time window of doing something beneficial is gone by then. So I think that there is some unique logistics that have appeared in addition to just the COVID-19 and the risk of stroke. There is actually another explanation, and whether it's true or not, we do not know, is that perhaps there is actually an actual decrease in the risk of stroke. And it's paradoxical, and it's interesting that there is a theory out there that because there was this mandatory social distancing, so whether mandatory social distancing, what effect it had on COVID-19 infection or not is one issue, but obviously we know that it actually will reduce the risk of other respiratory tract infections. So perhaps by actually curtailing other respiratory tract infections, you are actually seeing a decrease in the risk of stroke.
Huh.
So I think that there are several moving pieces in this equation.
So that's interesting because I heard what you just said, and so that might be an explanation as to why there would be fewer strokes, because social distancing has its advantages in other respiratory conditions. Before I let you go, if you would summarize again how something like COVID-19 and we think of strokes. I hadn't made the connection until I've just heard what you said, and I've read some of the stories that I've been reading. I hadn't made the connections about things like viruses and respiratory infections being such an important, perhaps, component with strokes.
So I think that if you look at the people who come in with strokes, and actually if you do a thorough analysis, because essentially, usually when we are evaluating somebody with stroke, we are so focused on the brain. But if you thoroughly ask them, and this is before COVID-19 came, that, whether you actually had any symptoms like cough, fever, shortness of breath, like in the month before the stroke, a lot of them will actually say they did actually have an infection like this. Huh. So the practical implication here is that when patients and their families, when they first come to the hospital with stroke, if they or their family member has experienced symptoms suggestive of an infection, they should alert the medical professionals that are involved in the care immediately.
Well, I think that's a great point to make, and especially one to emphasize here at the end of our visit today, and that is it makes sense when someone who is working, and maybe you're speaking for somebody who's had a stroke, or maybe you're a victim who can answer the questions. You need to be able to communicate well if you've had any other symptoms. That's why they ask, and we'll be asking that question, it seems like, more and more now, especially under this situation where maybe COVID-19 and strokes have that connection. Dr. Qureshi, you want to leave us with anything else this morning?
Yeah, I think that this issue about stroke and COVID-19 infection just elaborates that COVID-19 infection is a very global disease. And initially, though thought to be just involving the lungs and just a form of pneumonia, I think the last 4 months have increased our awareness that COVID-19 can manifest in many different ways. And I think the word of advice to everybody out there is that if you have any symptoms that are, suggestive of infection, and maybe even a symptom that, are just suggesting a clotting phenomena, like a stroke or a heart attack, or even, blockage of blood vessels to the legs or the arms, I think it's important to at least consider that there may be a COVID-19 infection at play.
Well, very good. I really appreciate your time and your insights on that. And I think, as you've said, this has got a lot of pieces to it that are pieces that we're learning more and more about. And you've helped to raise our awareness of this. Doctor, thank you for your time today.
You're very welcome. It was my pleasure.
He is a neurologist at MU Healthcare and also a professor of clinical neurology at the MU School of Medicine, Dr. Adnan Qureshi, who has been our guest. You're listening to Columbia Morning at KFRU.